Welcome to the Currents of Public Health webinar series, presented by the School of Public Health at Georgia State University. My name is Brian Greer, and I'm the Director of Development for the School of Public Health. The goal of this series is to explore relevant public health topics with members of our community. Today's topic is primary and secondary prevention of substance use and sexual assault. Our guest is Dr. Amanda Gilmore. Dr. Gilmore is a clinical psychologist and assistant professor in the Mark Chafin Center for Healthy Development in the Department of Health Policy and Behavioral Sciences in the School of Public Health at Georgia State. Dr. Gilmore's research interests primarily focus on the development and testing of integrated prevention programs for alcohol and drug use, sexual assault, and sexual risk behaviors among high-risk groups, including adolescents, college students, and service members. Innovative technology-based interventions to improve the rate of treatment access and decrease treatment dropout among underserved populations, and secondary prevention programs for individuals who experience recent sexual assault. Throughout her work, she focuses on cultural factors related to gender identity, sexual orientation, race, and ethnicity. She also focuses her work on reducing barriers to accessing treatment for underserved populations. Today's webinar will be guided by 3 general questions. What are you doing? Why is it important? And how can we get involved? One quick note, if you have a question at any point during our conversation, please feel free to type it in the Q&A box. We'll try our best to answer. So let's begin. Dr. Gilmore, welcome to the webinar. Please tell us about your research and what you're doing.
Yeah, I'm happy to. So I'm going to go ahead and just start off by thanking you so much for this opportunity to share my research with you all. I've been really passionate about what I study, and I hope that today I can incite some passion in you all to study this important topic. So my research primarily focuses on sexual assault, and the definition of sexual assault victimization really ranges from non-consensual sexual contact to completed rape. So when I'm talking about sexual assault, I'm not just talking about completed rape, I'm talking about that broad range of experiences. And as you likely know, the CDC provides statistics on national estimates of sexual assault victimization, and they have found that 1 in 3 women have experienced sexual assault. That number is pretty high, and you've probably heard the number 1 in 4, and that one typically refers to experiences of rape, but 1 in 3 is the number that we have right now in terms of how many women experience sexual assault more generally. We also know that 1 in 6 men experience sexual assault, so that number is also pretty high. And further, we know that sexual and gender minorities are experiencing sexual assault at higher rates than their heterosexual and cisgender counterparts. So this is something that's happening nationwide and globally at really high levels. And although sexual assault occurs among both men and women, the majority of sexual assaults are perpetrated against women. In fact, 9 out of 10 rape victims are girls or women. So although today I'm going to be talking about sexual assault generally, a lot of the research that I do and that others do focuses mostly on girls and women just because they're more likely to experience sexual assault. So one way to study sexual assault is to work towards primary prevention. Primary prevention, as all of you budding public health scientists likely know, means to conduct research to actually prevent something before it happens. So my goal is to prevent sexual assault before it happens. And we know that sexual assault is a preventable behavior. So that's something that I'm striving for. And there's several ways to prevent sexual assault. You can target potential perpetrators. So really working on the prevention of sexual assault perpetration. You can target potential victims, so working on risk reduction. Now, we all know that victims are not in charge of their sexual assault. So they are not to blame for their sexual assault. They can't control it. So you can really only focus on risk reduction with that population rather than true prevention. And another way is to address bystander intervention through primary prevention. And bystanders are people that are around when sexual assault situations start to occur. So that would be people kind of stepping in and preventing that sexual assault from occurring. One thing that we know is that alcohol actually influences all of these behaviors. So we know that alcohol can increase the risk of sexual assault perpetration. It can make people less aware of potential sexual assault risk and make people unable to respond even if they see that risk. And it also makes it difficult for people to identify a potential sexual assault situation as a bystander and actually intervene as a bystander. And because alcohol is a pervasive piece of sexual assault, I really just have a difficult time studying sexual assault prevention without targeting alcohol. We do know that there are sexual assaults that occur without that context, but a lot of the times it does. So that's why I really focus on integrated prevention. And interestingly, our research has found that if we try targeting alcohol alone, so reducing alcohol use among individuals, that in itself doesn't prevent sexual assault. So you have to do this integrated approach where you're targeting all of these different things in order to prevent this really complex behavior of sexual assault. Throughout my work, I use a social norms approach to reduce alcohol and sexual violence. And this is based on research suggesting that we overestimate other people's drinking or other people's risk behavior. So we think that other people are engaging in riskier behavior than ourselves. And we also think that other people are engaging in less protective behavior than we do. So, because of that, we actually behave in ways to fit in with our peers. However, the social norms approach to interventions actually does something really interesting where it corrects those misperceptions, and that actually does change our behavior. And this has been around for quite some time for alcohol. So much so that the National Institute on Alcohol Abuse and Alcoholism and their map of how colleges should actually intervene with college student alcohol use, they recommend this approach. And that's because it's really low cost and high reach. And I use this approach because it can actually change behavior within minutes. These interventions can be very brief. They can be minutes long, they could be an hour long, but really they're so brief and they make a big change. So for a big public health impact, this is the approach that I use. And although there are a lot of sexual assault prevention programs out there that are very effective, including one developed by Georgia State's own amazing Dr. Laura Salazar, today I'm going to be focusing on the ones that really target that social norms approach. So they're just within minutes. So they're different and they should be in they should be considered in the context of all of the interventions that are available. I wouldn't say this is the only way to go. It's one of the ways to improve our rates of sexual assault, to reduce them. And there are two prevention programs that have targeted alcohol and sexual assault using a social norms approach. And one of those I developed to address sexual assault risk for victimization in combination with alcohol use. And another one targets alcohol and bystander intervention. So what we did is we were realizing that these interventions are kind of separate and out there and they're working, but what we needed to do was have a more comprehensive approach that addressed perpetration, bystander intervention, and victimization. And so what we did is we paired up with, I paired up with Dr. Orchowski, who's at Brown University, who developed that program for bystander intervention. And we both paired up with Dr. Kelly Davis, who's an expert at Arizona State University on sexual assault perpetration, to make this comprehensive program that includes and addresses all of these primary prevention points. So we do have some evidence of this approach, and this comprehensive approach is working well, but it's still in testing. So our first study was a randomized controlled trial testing the efficacy of integrated alcohol and sexual assault victimization risk reduction. And we tested this among 264 women and found significant reductions in incapacitated rape in the 3-month follow-up compared to a control condition. And we found this was most effective for women with more severe sexual assault histories. And then with that new comprehensive program where we're targeting all of those different things, we're targeting alcohol, sexual assault victimization risk, perpetration, as well as bystander intervention. We did an open pilot trial recently and found that the students in this program found that trial, that evidence-based program, to be acceptable, helpful, and usable. So we're really excited about that. And so we think that this is an approach that could be used and could be effective. And it actually only took individuals 15 to 20 minutes to complete. So it's really brief, and we're really excited about that. And we conducted just recently a randomized control pilot trial, and we found that among the 99 students that were in this trial, that the approach was feasible, that we had significant reductions in alcohol use, and we had some significant improvements in indicators of sexual assault risk. So hypergender ideology, which is associated with perpetration. We found some increases in bystander self-efficacy and sexual assault risk perception. And so we really think that this is a promising approach, and we're continuing to work on that right now. So I just gave you a big overview of the primary prevention work that we've been working on. And so I just wanted to tell you what we're doing right now, what studies we have going on now. So that comprehensive approach, we have currently worked on adapting that for LGBTQIA students. And we're finding that if we tailor these interventions to LGBTQIA students, that it is actually helping reduce their alcohol use and change their sexual assault risk behavior. So that's something that's really promising because, as I mentioned, that's a high risk group for sexual assault victimization. Other primary prevention efforts that we're working on include primary prevention with adolescents. So we know that when people get to college, they may already have these risk factors, they may already be drinking, so we're trying to get to them a little bit earlier. So we're developing a tablet-based intervention with adolescents who are going through primary care visits. So we're trying to extend the reach to the general population, and we know that people go to their healthcare provider for prevention visits. So we're trying to really harness that and provide them with the care that they need in those moments. And what we've done is we've created this tablet-based intervention, and it's an integrated prevention program for substance use, sexual assault, and sexual risk behaviors. So we're just working on that right now. And lastly, we're adapting our comprehensive college program to Navy service members right now. So this is a partnership with Dr. Kristen Walter at the Naval Health Research Center in San Diego, also the same team that I mentioned previously at Brown and Arizona State. So we're all working together to try to address this issue within the Navy, because we know that service members experience alcohol use and sexual assault as well. So that's a big overview of my primary prevention work. I also work on secondary prevention. So this line of work really works on reducing the impact of sexual assault rather than preventing sexual assault itself. So although the goal is to prevent sexual assault, we know that it is still happening. So I'd like to help those that have experienced this in general. So the work I have really focused on is in an emergency room, because a lot of people, after they experience a sexual assault, go in for what's called a sexual assault medical forensic exam. People commonly refer to that as a rape kit. And I found that you can actually prevent the development of substance use and post-traumatic stress disorder using brief technology-based interventions. Specifically, we've tested the efficacy of a video made by Dr. Heidi Resnick called the Prevention of Post-Rape Stress video in large randomized controlled trials. And so for this video, we found that if you provide this video, now these exams occur really close after the sexual assault. So they occur within 5 days of the assault. Some places they have to occur within 2 days of the assault. And they're in a hospital setting. So if you show individuals a video about how to prevent the development of these disorders, you actually can reduce the number of the amount of cannabis use after a sexual assault for those who use cannabis before the assault. You can also reduce the frequency of heavy episodic drinking after the assault if they engage in alcohol use before. And you can reduce the likelihood of developing PTSD, post-traumatic stress disorder, for those with more severe sexual assault histories. So we found that to be really promising, just a brief video that you provide in the emergency room. And we also, within this framework, tested another video, which was a mindfulness video. And we found that this was actually helpful in reducing opioid use after sexual assault. So really taking together all of the work that I'm currently working on, I do try to have an angle of integrated programs, because we know that health behaviors don't occur in a vacuum, they occur together. And that's something that we can target within integrated programs. And these really brief technology-based programs can have a large impact if done in a way that targets evidence-based practices. And they can really allow for the unique needs of high-risk populations.
That is some very interesting work that you were doing, and I have a couple of just follow-up questions to ask you. Do you have? I know you said that the primary prevention programs were very sometimes quick interventions, or very short, sometimes minute long, or technology based. Do you have some examples of what that would look like for us if we were to actually see that in action? What would it be like?
Yeah, so I don't have any to show you today, but really we provided these over the web. So they're web-based programs. And what you do is you fill out a questionnaire about your own behaviors, your own risk, and you get some brief feedback about how your risk and your behaviors compare to other students or other peers, depending on the population. So really that would be in the form of, of graphs showing what your use looks like compared to others. It also is just personalized feedback that, hey, this many people like you, depending on what your peer group is, this many people actually think that, you would be respected if you stood up as a bystander. So it's really just a personalized messages that are delivered.
Well, that's neat. So I guess the elephant in the room sort of question is, so how has your research changed due to the COVID-19 pandemic?
Yeah. So we've actually been lucky enough to continue a lot of our research during the pandemic. There's been some that has halted, obviously, but our work with college students has been really interesting over the course of the pandemic, because there's a lot of research out there suggesting that alcohol use is going up quite a bit. And so because of that, doing alcohol intervention testing at this time is really interesting to see if we can actually, if we can actually impact alcohol use even when it's on the rise for another reason. And we've actually been successful in that these approaches still work during the pandemic. So that's really exciting.
Yeah. Well, moving on with my next main question, can you explain a little bit further why this research is so important?
Yeah, of course. Well, sexual assault results in significant public health costs. So I'm not sure if you're aware of this, but the United States pays about 1 trillion of the total $3.1 trillion of lifetime costs accrued by sexual assault. So this includes hospital and medical bills, lost wages, judicial costs. So this is really an important and costly concern that needs to be addressed. And we know that sexual assault can lead to a lot of long-term problems. So substance use, sexual health problems, depression, suicide, pain, post-traumatic stress disorder. That's just a few. It can also complicate medical problems as well. And we know that sexual assault doesn't just occur in adulthood, it also occurs in childhood and adolescence. And individuals who experience sexual assault in childhood or adolescence are 2 to 3 times more likely to experience sexual assault as an adult. So re-victimization is really common, and that can complicate things as we go along in adulthood. So that is something that's really important to address early on, and that's why my focus is more on prevention. We also know that half of all of the lifetime cases of substance use disorder begin prior to the age of 14, and 75% begin by the age of 25. And we know that substance use can have long-term effects and can really complicate the trajectory of other mental health disorders. And research has found that people tend to cope with sexual assaults by using alcohol. That's the research word for that is negative reinforcement theory, but it's more commonly known as drinking to cope or self-medication. So we know that people engage in alcohol use because of their sexual assault. And we also know that people are at higher risk for sexual assault and sexual assault re-victimization because of their alcohol use. So really taking that all together, I think it's a big public health issue that is important. And although alcohol use and sexual assault are important public health issues separately, I think when you look at them together, they're also important to look at in that integrated way. And there's also a lot of really great public health research that can be done by looking at secondary prevention. So we know that secondary prevention, or looking at people who experienced a recent sexual assault, we know that only 20 to 25% of them actually go in and receive a sexual assault medical forensic exam after the assault. And then moving on from that, we know that 30 to 40% of those people receive care after that initial exam. So that means that of that small group, only 60 to 70% are going to actually receive the healthcare they need after that exam. And so it's really important to find a way to reach this population that we hope won't develop long-term problems, but really could. So one way that we try to do this is using platforms that will allow for larger reach, like health programs, or these videos that we've developed, or anything like that, to really just get the word out there on how to reduce the long-term effects after sexual assault.
So are there any communities that are more impacted by sexual assault than others?
There are, yes. So as I mentioned in the beginning, girls and women are more likely to be assaulted than men, although men do experience sexual assault. LGBTQIA communities experience sexual assault at higher rates. And some interesting work that some members of my lab, Dr. Liz Mosley and Jessica Prince, are working on, have found that there are some different types of sexual assault experienced based on race and ethnicity. So they're finding that Black women are experiencing sexual assault perpetrated by the use of a weapon, more commonly occurring than among white women. So although everyone's kind of at risk for sexual assault, there are different groups that are higher risk, and those types of assaults might be different.
You were just speaking about technology, and I just saw a question come across that might segue well to what you were discussing. This individual asked, many survivors of assault never report their rape kits. The video intervention delivered in the hospital setting looks promising. Are there any promising ways that these interventions can be provided to victims who are less likely to report? And that's through college or high school, et cetera.
Yeah, and we are kind of working towards that. I know that a group at the Medical University of South Carolina is currently trying to adapt that video that was developed by Heidi Resnick to be more available to individuals. And there are lots of wonderful programs where people can call anonymously that I'll get to in a little bit. And they do have some great resources. There are nonprofits throughout the United States that can provide some nice tools for individuals after the assault. And there is this really great program that is a victim assistance program. So anyone who experiences a crime can have their services paid for by the government. Now that requires a lot of paperwork and working with the police. So that may not apply to that population that was asked about, but there's a lot of work being done in these areas, especially in colleges and in other institutions where disclosing is difficult.
Well, that I think moves well to our final main question. So how can we as a community concerned about public health and this issue become involved with your research?
Yeah, there's lots of places where you can get involved. So we have a research lab here at Georgia State. It's called the Alcohol and Sexual Assault Prevention Lab. I co-lead that with Dr. Rochelle Leone. And I have a link for our current projects, and there's an application of how you can apply to work with our lab. We're doing lots of interesting things. I think I'm a little biased though. There's also this really great center here at Georgia State called the Center for Research on Interpersonal Violence. And there's a lot of researchers here focused on this issue. We are kind of in a lovely hub of researchers at Georgia State who are very passionate about reducing sexual assault. And so there's a lot of fantastic researchers here. And in the School of Public Health, we have Dr. Laura Salazar, who focuses on this as well. There's just, you're in a great spot to really do that. So I would recommend looking at the faculty here, volunteering in research labs here, and just getting involved in that way. So that's how you can do that at Georgia State. You can get involved as a community member, not just as a student or budding researcher. So at Georgia State, you can just be an active member of your community. So if you see something, actually step up and say something and act as a bystander to prevent sexual assault. And that's hard to do, but there's some tools on the student health promotion website on how to do that effectively. There's also some really lovely nonprofit organizations in the state of Georgia, and you can find a lot of information about them on the Georgia Network to End Sexual Assault. You can become a volunteer. So there's trainings on how to become a volunteer. You can also donate money. As you can imagine, during the pandemic, there's a lot of need for funds for recent victims or people who are impacted by sexual violence. So that can be something that you can do as well. You can also get involved nationally. So there are national organizations. RAIN is a really big one. RAIN stands for the Rape, Abuse, and Incest National Network. And so you can volunteer as a hotline, someone to answer the hotline. So that's the National Sexual Assault Hotline. There's also other ways to get involved that they list on their website. So you can spread the word on social media about what they're doing. You can help with fundraising. They also have opportunities to engage as a student activist. So I would highly recommend looking at their website and seeing what kind of things you can do to get involved nationally. You can also get involved internationally. So unfortunately, this is an issue that impacts individuals globally. And so that 1 in 3 number does apply globally as well. So the World Health Organization focuses on preventing violence against women. So you can really look into what they're doing as an organization and get involved in that way. And there are, to connect international work with Georgia State work, there are researchers here at Georgia State doing international work on this topic. So Monica Swan would be a great person to get in contact with if you're interested in addressing sexual assault internationally.
Well, thank you very much. That's very helpful, and I think something that those watching today will be able to look into further to figure out how they can support this important issue. I know we're running short on time. I did see a couple more questions come across, but I will pick one that looks interesting to ask. Talking about primary prevention, do you have any plans to do some intervention in grade schools to educate them about this issue?
Yeah, I do not personally, but there are some really fantastic researchers out there that are working on that at a younger age level. So there are programs out there that have been implemented in elementary age schools that seem to be somewhat effective. And so please feel free to reach out to me and I can connect you with those researchers, because that is also very important work to start at a younger age.
Yeah, I know a lot of us, I've got young children, and I think you and I have discussed about trying to raise children right now and talk about these issues. And And so that's very important. So I think that's a good question, something to look for.
Yeah.
So my final question for you is, again, back to the pandemic. You can still get involved even during this pandemic with this issue?
Definitely, yes. As I mentioned, there's a high need right now, and so you can. I know it's hard to provide money at this time for a lot of people, but donating to these organizations is one way that you can get involved. The national hotline is a hotline, so you can volunteer as a hotline member even remotely. In our work in our lab, we are all virtual right now, so you definitely are encouraged to apply to work with my research team because we're doing work remotely as well. So there's lots of things that you can do, and I do know that the Genesea, the statewide organization, they are providing trainings virtually as well, so you can become a trained responder to sexual assault even if you aren't in person. There's lots of things you can do.
Great. Well, we'll have to end it there. I thank you again for your time, and I appreciate this wonderful research that you're doing and for taking the time to share with us.
Thank you.
I also want to thank all of you who are attending the Currents of Public Health webinar today, and so please save the date for the upcoming Kruder-Katz lecture on health equity on Thursday, November 19th at 2 p.m. The featured presenter will be Angela Glover Blackwell, who is the founder and residence at PolicyLink, the organization she started in 1999 to advance racial and economic equity for all. In closing, the School of Public Health at Georgia State University is one of the most diverse schools of public health in the nation, offering a Bachelor of Science in Public Health, a graduate certificate, a public health degree and 5 concentration, a PhD degree in 4 public health areas of knowledge, and a Doctor of Public Health, DRPH. The faculty and students conduct cutting-edge research on the complex 21st century public health challenges facing cities across the globe, and carried out in partnership with communities, the residents, and community-based organizations committed to health equity. If you would like more information about our programs and how to support the School of Public Health and our students, please visit publichealth.gsu.edu. Thank you again, Gilmore, and thank you all for attending, and please join us for our next webinar.